companies. Smaller companies, on the other hand, are more scared of losing employees, especially since their margins are smaller, and they may have a fear that their employees will leave because of mental health issues, which they would want to avoid. Sorry.
Hi, I'm Disha. This a visual shows companies that do have wellness programs. This image makes it quite evident that larger companies are far more likely to have wellness programs than companies with fewer than 1,000 employees. In comparison to smaller companies, larger companies have significantly more funding and resources to offer their employees wellness and mental health initiatives. As a result, they are more likely to implement a wellness program because a higher proportion of people could benefit from it. This visual shows companies that do not have wellness programs. This image directly corresponds to the one before it, supporting our theory. It was obvious that larger businesses with more than 1,000 employees made up the vast bulk of the last image. So now that we have a closer look at this image, we can see that smaller size companies in the survey we used make up the largest proportions of the pie chart that shows that they have a lack of wellness programs. So as I said before, smaller companies don't typically have funding to support wellness programs, which is why they do not implement mental health resources, but instead larger companies do. This graph shows consequences from talking about mental health to coworkers. This bar graph displays how company size affects the response to the question, and the employees either responded with a yes or no. From this graph, there's a clear positive correlation between company size and employees willing to discuss a mental health issue. This does not completely support a theory that larger companies take care of the employees' mental health, but it does show how talking about mental health can pressure employees from discussing them with their coworkers. This visual we created shows discussing mental health with coworkers. Employees in larger companies were reported to have significantly less tendency to discuss mental health with their coworkers than employees in smaller companies. This does not completely coincide with our theory that, that larger companies are taking care of their employees' mental health better, but it gives us a new perspective on how peers are willing to talk to each other based on their company size, as well as their social environment. So our conclusion to the big question, are larger or smaller companies taking care of their employees' mental health better? We can conclude that larger companies are taking care of their employees' mental health problems better than smaller companies. Larger companies provide many resources, have programs that are able to help their employees, and are more willing to talk about mental health. Work gets stressful, so having mental health programs help employees feel supported. As I said, big corporations have benefits and more funding to help their employees seek treatment. And they don't fear as much of losing an employee for some time because it doesn't have as much impact as it would have on a smaller company. Since smaller companies have less financial resources, and as well, the COVID-19 pandemic impacted smaller businesses much more. So overall, larger companies are doing a pretty good job supporting their employees' mental health, and smaller companies are making an effort, but it is understandably much harder for them to implement mental health programs and resources for their employees. Hopefully in the near future, all companies have mental health programs and resources available for their employees.
Hi, my name is Skylesha, and our mission statement is that we want to see the effects of companies' attitudes towards people with mental health and illnesses. A survey on mental health in the tech workplace was conducted in the year of 2014, and the survey asked a multitude of questions ranging from the participants' family history of mental illnesses to whether or not they feel safe and comfortable with talking to their supervisor about their mental health conditions. From this large data set, our group separated the survey results into 5 separate visuals: wellness programs at work versus how often mental health affects your work, any treatment done versus seeking help, anonymity versus any observed consequences from the mental health conditions, whether or not you're willing to talk to your supervisor about your mental health and seeking help, and if the company provides benefits versus how easily it is to take a leave due to mental health. From the visuals we have created, we were able to explore more and understand in more detail about mental health in the workplace, and concluded that mental health is impacting employees at work, and that if employees provide solutions and programs to help with the mental health conditions, employees will use them to improve their health and experience at work. So our first graph is a wellness program at work versus how often mental health affects your work. So this is a visual showing that even though mental health conditions are interfering with employees at work, there's about the same number of companies with no solutions in a wellness program as there are companies with a wellness program to help alleviate the mental health conditions. This visual is important because the majority of the people in the survey stated that their work will at least somewhat be impacted by mental health. Our next diagram is a pie chart comparing supervisors versus seeking help. This visual shows that more than half of employees working in a company are not provided resources to learn more about mental health issues and how to seek help. However, we can see that the employees that were provided resources, a higher percentage of them sought treatment compared to those that did not seek treatment. This is important because it shows that employees will use the resources provided to them by the company to try to seek help and learn more about mental health issues.
This
Gianna, I think you are frozen.
next graph is on the treatment.
There you go. Sorry, froze for just a second. You keep going now.
Okay, this next chart is on treatment versus seeking help. This pie chart shows how employees being kept anonymous can affect if they will have observed any mental health consequences. 57% of the respondents said that they did not know if their anonymity was protected, but they did not know any consequence. But they did not have any known consequences for mental health. 25.2% of respondents said they did not know if they were being kept anonymous, and they did not have any consequences for mental health. Our next graph is on anonymity versus observed consequences. The relationship between employees, supervisors, and employers are shown here. Over 50% of employers do not provide resources on seeking help for mental illness, and only 20% of tech employees with mental illnesses are provided with resources. Our next graph is titled, Does the company provide benefits versus how easy it is to take leave for mental health? The bar graph shows how easy it is to take leave depending on whether or not you have benefits. While some employees do not know whether or not they have benefits set up for them if they have mental health issues, it is clear that there is somewhat of a correlation between not being able to take leave for mental health issues and companies not offering benefits for mental health related issues. When companies do provide benefits, it's significantly easier to take leave for mental health than when companies do not provide benefits at all. For many comparisons of survey results from tech employees, we have tried to find the effect of different companies' attitudes towards people with mental health illnesses. We have found that there seems to be a lack of mental health awareness and proper work accommodations such as benefits, leave, anonymity, and other resources. But above that, there seems to be people that feel that they cannot talk to their supervisors or think that they will be receiving negative consequences for admitting to have bad mental health. However, these feelings seem to be tied to not having access to those resources that were previously mentioned. After taking a close look at these statistics, it is evident that tech companies need to take consideration the mental health resources they provide and try to better those resources for the sake of their employees.